You're listening to Seattle Real Estate Podcast.
So everybody knows about the uproar of Joe Rogan taking as he put it, through the kitchen sink at his COVID-19. He tested positive. He did I think he did like 3 shows in Florida, comedian also. That guy puts in work. Not only is he the number 1 podcaster in the world, he's still on the road doing his comedy. I love that about him. He just kind of keeps on going, doing his thing, putting in his reps. He's just going. He came back from Florida and he got a little sick. And so he literally, by his own admission, threw the kitchen sink at COVID-19. Had his doctors prescribe him a bunch of stuff. One of the things that he took was Ivermectin. And everybody got really worked up over this. Oh, that's a horse dewormer. Well, it's kind of like saying that antibiotics. Oh, you took an antibiotic for a dog. Well, dogs get antibiotics, so do humans. Typically, doctors don't prescribe the ones for dogs to people. That's just how medicine works. That's the way I see it anyway. But Rolling Stone was forced to issue an update after viral hospital Ivermectin story turns out to be false. So the media is doing they're really honing in on this Ivermectin. And it's kind of like, this is ridiculous. What are you guys doing? If Joe wants to take it and if his doctors prescribe it, you know what? I say let him. He's taking a bunch of other stuff. He took a steroid in there. Not a growth steroid, but, medical steroid, as they all are. But sometimes they get used for other purposes. And so you've got this story out there trying to discount the Ivermectin thing because Joe Rogan said he took it on his podcast. And he clearly comes right out and says, I am not a doctor, kind of like I do. Hey, I'm a real estate guy. Why would you listen to me on medical stuff? You wouldn't. All right, so that's what we're talking about today. I just couldn't help myself. This has nothing to do with real estate, but it's a pretty funny story because when you're going to read the story out of Oklahoma and then Rolling Stone and a bunch of other major media picked it up and, oh, hey, that story just flat wasn't true at all. All right, that's what we're talking about today. Before we jump on in, if you're new here, my name is Sean Reynolds. I own a couple of real estate companies, and I read the news that I find interesting, and hopefully you do too. And I bring you a reasonable perspective. Stories that lie to you from mainstream media, I'm no go on that. That's what we're doing today. All right, so Rolling Stone forced to issue an update after the viral hospital Ivermectin story turns out to be false. The Northeastern Hospital System released a statement contradicting the story. What do we have going on here? How could this possibly be? We're going to go right to the heart of things here. Fox News. We're going to get the real scoop. All right. And I jest when I say that as well, because we know that all media has a bias, right? Even mine has a bias from the business standpoint, from trying to be reasonable. Does that make sense? No, not really. Does that make sense? Truth is probably somewhere in the middle. Rolling Stone was forced to issue an update to its viral story about Oklahoma hospitals being overwhelmed by patients who overdosed on the drug Ivermectin after the doctor it cited was contradicted by the hospitals he referenced. On Friday, the Liberal magazine, let's just point out that Rolling Stone is liberal. On Friday, the Liberal magazine published testimony from Dr. Jason McElyea, who told a local news station that hospitals were being overrun from patients overdosing on ivermectin, which resulted in other patients waiting for treatment. McElyea claimed the situation was so bad that gunshot victims were being neglected. When I first read that story, I saw that story go out, and I'm kind of like, now, do you put the gunshot victims in triage, or do you make them wait in the ER? Yeah, I know you're bleeding out there. I know you got a gunshot wound, but you're going to have to wait for all these other people who OD'd on horse dewormer. Oh, this just doesn't make any sense, does it? It's like, no, the gunshot victim, they get first priority. Triage. Try and get the bullets out and seal them up so they stop bleeding out and die. That's the end goal there, right? I mean, in layman's terms. So to be saying that it was so bad that gunshot victims were being neglected, that just didn't make a lot of sense to me. The ERs are so backed up that gunshot victims were having hard times getting to facilities where they can get definitive care and be treated, McElyea said. Okay, interesting. The story, which originally appeared in Oklahoma's K4-TV News, was widely shared by reporters, including MSNBC anchor Rachel Maddow. Oh, Rachel, you didn't fact-check your story. You didn't dig down deep. You didn't dig at all, it looks like. All right, let's jump over. I'm going to read that story super quick and we're going to come back because this is worth. All right, this is Oklahoma. My parents live in Oklahoma. And Dad, you can't blame this story on Trump. My dad likes to, you can blame a lot of things on Trump. This story, you cannot. All right. I don't think my dad watches my podcast. I know my mom watches the comments on the podcast because she told my dad, hey, do you think Sean saw the comment from some foreign country? And I'm like, no, I missed that one, Mom. But yeah, I try and read as many comments as I can, but there's a lot of comments. So patients overdosing on ivermectin backing up rural Oklahoma hospitals and ambulances. This is legit the story on Oklahoma News 4. All right. And we got a video of this guy, this doctor just spouting some stuff that apparently wasn't true at all. A rural Oklahoma doctor said patients who are taking the horse dewormer medication, ivermectin, well, let's back up there. All right. People take ivermectin too, but there is one medicine for people, one medicine for horses. Different. All right. So taking ivermectin to fight COVID-19, they're causing emergency rooms and ambulance backups. There's a reason you have a doctor to get a prescription for this stuff because it can be dangerous, said Dr. Jason McElyea. All right, so are we led to believe that people in Oklahoma are not bright enough to go to their doctor to get this and that they're just going to their 4-H store, whatever it is, their local co-op, and yep, give me some horse dewormer. I'm going to chow down on that. That's what we're kind of led to believe here, right? That's the insinuation. All right. And if you want to, you can go watch the video of this doctor. I mean, it's pretty entertaining. Dr. McElyea said patients are packing his eastern and southeastern Oklahoma hospitals after taking ivermectin doses meant for a full-size horse because they believed false claims the horse dewormer could fight COVID-19. Let's jump back to Joe Rogan. Now, Joe Rogan, amazing shape, right? Amazing shape. Fight by day, podcast by night, workout by day, podcast by night, something like that. And that's literally what he does. He has a super clean diet. He is not obese, like a large number of people who've had amazing problems with COVID-19. He is not obese. He's generally pretty healthy. He has access to doctors who, are willing to try stuff, and he does try stuff. And shortly after testing positive for COVID-19, he threw the kitchen sink at it, and now he's testing negative for COVID-19. Interesting how that works. I don't know. Could that just be totally random, all that stuff he took? Could that be random? Yeah, it could be. We don't really know. We don't have enough data on any of this stuff. And does ivermectin work against COVID-19? The studies are kind of inconclusive, right? I mean, I've looked at a bunch and I kind of went, I don't know. And I'm not a doctor, right? Real estate guy. Don't know about this stuff. Let's get back here. The ERs are so backed up that gunshot victims are having hard times getting to facilities where they can get definitive care and be treated. All right. This is straight up the article. So we got backing up ambulance systems. All the ambulances are stuck. If there's no ambulance to take the call, there's no ambulance to come to the call. The doctor said many of his patients aren't afraid of ivermectin. Many of them have used it on their livestock. Growing up in a small town, rural area, we've all accidentally been exposed to ivermectin at some point. So it's something people are familiar with. Because of those accidental sticks when trying to inoculate cattle, they're less afraid of it, he said. And so they're running out in droves and taking a horse dewormer. I don't think so. That doesn't make a lot of sense. Now the rural patients are going into their local agricultural or tractor supply store, ignoring the warning signs surrounding the products and figuring out a dosage themselves. Well, horse weighs 2,000 pounds. I don't know. I weigh 200 pounds. I'm going to take a tenth of this. Well, let's see how it goes. I don't see a lot of people doing that. I see people, even in rural communities in Oklahoma, all right, getting on the internet, going on the interweb, and trying to figure this out instead of, I'll just take 1/10 of it. What could go wrong? This will be fine. I mean, putting stuff in from the local agricultural store. What could possibly go wrong? No, people know not to ingest that stuff. This is ridiculous. So some people are taking inappropriate doses have actually put themselves in worse condition than if they'd caught COVID, said the doctor. So we are just making stuff up at this point. And then we've got a picture of what looks like 2 boxes of candy, but instead they are ivermectin apple flavored for horses. And it looks like a really long syringe, and you just pump out some apple flavored ivermectin, and the horse just loves it. And they get dewormed, and that goes down that road. Dr. McElyea said the patients are suffering from nausea, vomiting, muscle aches, and cramping, and that's only in minor cases. The scariest one that I've heard of and seen is people coming to us with vision loss, he said. He went as far down as vision loss. I mean, deep, deep, deep. Even the manufacturer states there is no scientific basis or meaningful evidence ivermectin is effective against COVID. However, many of the Tractor Supply stores say their shelves are empty. You have to ask yourself, if I take this medicine, what am I going to do if something bad happens? What's your next step? What's your backup plan? The doctor said. If you're going to take a medicine that could affect your health, do it with a doctor on board, which Joe Rogan did. All right. Make those decisions with a thoroughly vetted opinion, which Joe Rogan did. There's a lot of schooling that goes into that. That's what the doctors go to school for. It's not just something you look on the internet and decide if it's the right dose. Fully agreed. And, if it says animals use only, probably don't take it yourself. Go to your doctor. Get the people version, if that's really your thing, if that's what you're going to do. All right, so that was the story. Straight up, lead news story in Oklahoma. All right, so then Rachel Maddow from MSNBC, short dark hair, kind of thin face, you know who I'm talking about. She tweeted out, patients overdosing on ivermectin backing up rural Oklahoma hospitals and ambulances with a quote of, the scariest one I've heard and have seen is people coming in with vision loss. He said. She's quoting the doctor. And we've got that picture right on her tweet of the ivermectin, in the candy boxes for horses. Whew, and it's a lead to that story. Okay, so MSNBC, fellow MSNBC left-wing anchor Joy Reid also promoted the story during her show on Friday, repeating McElyea's claims. He's a doctor. He wouldn't lie to us. Who's the guy in the news that Dr. Fauci? I can't remember. Oh, what happened? What's happened lately with him? Whew, that's a whole nother podcast, right? That's some good stuff there. An emergency in one rural Oklahoma town is being overwhelmed by people overdosing on ivermectin, the horse deworming medication. It's gotten so bad that gunshot victims are having to wait to be treated, she said. This is Joy Reid from MSNBC. The story was also shared by the New York Daily News, Newsweek, The Guardian, and Insider. However, here's where it starts to get good. The Northeastern Hospital System, which McElyea works for, issued a statement regarding his association with the hospitals reported in the story. Interesting. The NHS, Northeastern Hospital System, revealed while McElyea is affiliated with a medial staffing group, he has not worked at the location in question for 2 months, nor has he treated any ivermectin overdoses. What? What is going on here? Did this doctor just run at the mouth? Did he say a bunch of stuff that wasn't true and he just figured he wouldn't get caught? I mean, how does that work? You just say, there's got to be more to this story. I know there's got to be more to this story. Or is there? If there's not, this is just a total travesty. It's like, you're just making stuff up, just wildly incorrect. And you're a doctor, and people wonder why we don't trust doctors or the medical system or the government, because you got stuff coming out like this. It's like, let's just keep going. Although Dr. Jason, this is the hospital talking, although Dr. Jason McElyea is not an employee of NHS Sequoia, he is affiliated with a medical staffing group that provides coverage for our emergency room. With that said, Dr. McElyea has not worked at our Sallisaw location in over 2 months. NHS Sequoia has not treated any patients due to complications related to taking ivermectin. So, if you haven't treated any patients due to complications related to ivermectin, how can what the good doctor is saying be true? It can't. Those are contradictory claims, right? This includes not treating any patients for ivermectin overdose, the statement reads. Nobody's taken over ivermectin. Nobody's overdosed on it. Story, not true. Total bag of lies. And NBC, just not fact-checking. Furthermore, the NHS insisted that patients are not being turned any for emergency care in contrast to the recent reports. Oh, and by the way, yeah, we don't have an issue with gunshot wounds and them getting help. When somebody gets shot in our hospital in an area in Oklahoma, they get the adequate attention they need, as they should, right? All patients who have visited our emergency room have received medical attention as appropriate, NHS said. Our hospital has not had to turn away any patients seeking emergency care. We want to reassure our community that our staff is working hard to provide quality health care to all patients. We appreciate the opportunity to clarify this issue, and as always, we value our community's support. Can you imagine the hospital admins going, okay, who is this doctor? Oh, he hasn't been here with us, and he is saying what? This isn't true. What is going on? What are we doing? Do you think that doctor has been let go at this point in time? Probably. Rolling Stone later published an update to the top of the story, which repeats NHS statement. One of the pictures in, let's go back. Okay, so I need to remember where I was there. Patients overdosing. One of the photos on this was really entertaining. And what it was a picture of people with masks on, and you were supposed to believe that they were waiting for their care. These are people like kind of standing in a line. It made them with masks on. They all had big puffy coats on. It was a clear day. Big puffy coats on, obviously very, very cold. There was no gunshot victims in there. They were wearing heavy coats. We're in early September. Is there any weather out there where it's really, really cold yet? I don't think so. So my point is the entire article was just some real nonsense. Just some real nonsense. And mainstream media picked it up. This is a pretty good one. Let's just roll with this. So that's why so many stories that I get sent, I kind of fact check a little bit. And if it seems a little weird to me, hey, I'm not going to read it. I need to have at least a few sources. This one, it seemed to have the source of the good doctor, who it doesn't appear has the public's interest in mind because he's just making stuff up. All right. So Rolling Stone later published an update to the story, which repeats NHS's statement. All right, we've got an update. Here's where we're at now. That whole thing we said back there, yeah. Here's an update from the hospital. We're just going to run with that. Critics slammed the magazine for publishing what appears to be a false story. Independent journalist Glenn Greenwald tweeted, "The only reason Rolling Stone is calling this an update as opposed to what it is so plainly a retraction is because liberal outlets know that their readers don't care at all if they publish fake news, as long as it's done with the right political motives and goals." Is that true? Is that true? All you liberals out there, do you just read news and go, yeah, I think some do. I think some don't. I think some people on the right do the same thing. This is a good one. And so that's why, you gotta read through stuff. And does this make sense? If it doesn't make sense, it might not be true. And I think a lot of us grew up in an era where you saw the news and you're like, well, that's in the media. It's got to be true. They wouldn't lie to us, would they? Our government wouldn't lie to us, would they? Dr. Fauci wouldn't lie to us. I know that for a fact. I mean, oh, yeah. I mean, would he? Oh, horrible. Rolling Stone misspells correction or retraction, Fox News contributor Joe Concha tweeted. That's funny. All right. Rolling Stone proving it did not learn its lesson from the UVA rape hoax disaster. Remember that? Chick said she got raped, like 14 guys at University of Virginia, just got taken down from the lacrosse team, I believe it was. Yeah, that was a complete hoax. Yeah, they ran a major story on that. It ended up not being true. So that's kind of what we're talking about. And that's what Washington Free Beacon reporter Chuck Ross wrote. Crazy stuff. I mean, just called right out. So here's Rolling Stones. Here's their update. Northeastern Hospital System Sequoia issued a statement. Although Dr. Jason McElyea is not an employee of NHS Sequoia, he is affiliated. And it just goes right through and says, yep, he hasn't treated anybody. We haven't treated anybody. There's been nobody with the overdoses. And they basically just refute everything in that story. Just, yeah, not so true. Just, yeah, no, yeah. I mean, it's insane that this is a major media story. Just nutty, right? All right. And then we've got, here's this tweet from Chuck Ross. Rolling Stone proving it did not learn its lessons from the UVA rape hoax disaster. And you've literally got people really bundled up. They're all just it looks really cold. They're kind of shivering, waiting in line on the sidewalk. That is gunshot, and the title is Gunshot Victims Left Waiting as Horse Dewormer Overdoses Overwhelm Oklahoma Hospitals, Doctor Says. The whole thing is just a complete fabrication. It's just, I mean, there's nobody that's a gunshot victim here. This isn't even the right season. This is not September anywhere in the United States right now. Maybe Alaska. Is it cold up there right now? Maybe, probably some areas. Further north you go. I mean, it's getting a little bit chilly here in Seattle, and we're pretty far north, right? Upper left, northwest of the USA. But we're not, I mean, I've got a puffy coat, but you get my point. It's not necessary at this point in time. So just crazy. Charles Fane Lehman, he tweeted out, this is a lot of words to say Rolling Stone got scammed, and other mainstream media picked it up and ran it as well. So there's that. It doesn't matter, and here's another tweet from David Marcus, it doesn't matter if the Rolling Stone hospital story is a fabrication, as long as it makes people who blindly obey COVID protocols and restrictions feel superior, it's done its job. And how many conversations have you had or have you heard people have? Maybe none. Maybe this is the first time you're hearing this story, but you always hear these stories and you're like, that just doesn't sound true. Maybe because it's not. And that's what we're learning on this one. It's just flat not true. But people wanted it to be true. And it just sounded so good. Rural Oklahoma, it's overwhelming the hospitals. Oh, it's not? There hasn't been anybody that's had a gunshot wound, that's had a hard time getting into the ER, and there's been no ivermectin overdoses, and there's nobody really taking ivermectin, horse deworming medication. This doesn't look good. just the whole thing is just nutty. Ivermectin is most notably used as a cost-effective treatment for malaria and head lice, as well as heartworm in domesticated dogs and cats. The FDA warns against the use of ivermectin for treating COVID-19, noting that taking large doses of this drug is dangerous and can cause serious harm. Taking large doses of anything can cause serious harm, right? Just don't do it. Be smart about it. The FDA also warned against ingesting the derivative form usually meant for dogs or horses. Yep, we get that. But we're just being shoved so hard into, get vaxxed, aren't we? Anything else on the peripheral, don't listen to that. That might not work. And so then when you've got a rogue dude like Joe Rogan coming out and saying, all right, here's what I did. And he openly just says, I'm an idiot. He literally has said that or tweeted that out, whatever. I'm an idiot. Don't trust what I say. And I say that as well. I'm a real estate guy. I don't know anything about the whole medical thing. I mean, it's crazy, right? And for others to come out and say, oh yeah. And so now you got a rogue doctor doing the same thing. Gunshot victims, they're not getting the right treatment here because so many people are overdosing on ivermectin from their local hardware store. I mean, that's a believable story in Oklahoma. Here in Washington, I don't think you get away with that. The FDA has not authorized or approved ivermectin for use in preventing or treating COVID-19 in humans or animals. All right? The FDA hasn't approved a lot of stuff for a lot of things, though. Ivermectin is approved for human use to treat infections caused by some parasitic worms and head lice and skin conditions like rosacea. The FDA website states, don't really know what that word is. It's a medical condition. We'll leave that up to the doctors. All right, so there you go. Yeah, that's a fancy little news story there that was entirely 100% untrue, that Rolling Stone ran, and then other mainstream media sources, including MSNBC, also ran. So when you see these stories, think to yourself, does this make sense? And especially if you see them on your preferred news network, if it doesn't make sense, maybe discount it a little bit. And man, I discount a lot of news these days. A lot of news, because so much of it just to me seems like, all right, that is some real BS. That's some nonsense. That doesn't seem reasonable at all. And like I said, you got to read stories from the far right to the far left, stuff in the middle. You got to figure out on your own what it is that you believe and what news sources you want to hear. So that's why I spend so much of my time, babbling on about being reasonable, because I sit here and I'm like, does this make any sense? No, that doesn't. Does that news story make any sense? Even if it's true, there's a lot of angles there that I question. So I stick with stuff that I know, that I've either experienced something that I can contribute firsthand. Maybe it's business, maybe it's real estate, maybe it's, going to some ridiculous protests, something like that, something of those natures. But when I'm sitting here reading the news and you've got a story that Rolling Stone sent this out and, it was all a load of crap. That's pretty interesting, right? Kind of goes to show if this would have happened, call it 30 years ago, Rolling Stone would have been done, right? They would have just, as a publication, they would have been done. Something this severe. I don't really know. I would have been 30 years ago. I was 22. Head still mostly up my rear end because, you're young, you're trying to figure out what you're doing and trying to get out there. And I was, for some reason, trying to get married and have kids and, start that whole family thing really early and buy a business that wasn't successful initially and struggle through that, doing that. So at that age, you don't really pay attention to like what's fully going on. But I believe that if Rolling Stone would have run a story like this back then, somebody would have just sued them and said, yeah, and would have taken them down or would have attempted to or something. But in today's news world, there's so much nonsense running around out there that it's just like, oh yeah, Rolling Stone, they issued a retraction. We've got an update from the hospital. That whole story that we shared with you in the nation that went viral about, the ivermectin that, is meant for horses and people taking it. Yeah. So just none of that was true. Oh, all right. Well, at least they issued that update. They're trying to be honest, trying to be an honest news outlet and get the truth out there. And if it takes two swings, it takes two swings. That first swing, that was not a good one. They swung for the fences, but boy, that didn't work out. All right. Hey, what's over on ABC? What's ESPN got for us today? What are we looking at there? Doesn't it feel like that's kind of what's going on? You get a bunch of news sent to you and you're like, does this make any sense at all? The funny thing is you had a doctor who got on video and basically said all this stuff. That can't be good for that doctor's license. Was there going to be a little inquiry? Probably not. We just don't worry about that stuff in 2021. It's okay. Hey, you made up stuff. You're going to allow you to keep your medical license because we know you're a good doctor. Deep down, underneath that other nonsense you said on tape, you're a good doctor. Just keep practicing. You keep doing you. All right, that's it for me on this one. And I'm joking about all that, by the way. Who knows? Maybe he'll get some kind of disciplinary action. I don't know. But if that does happen, I'll bring it to you right here in the Seattle Real Estate Podcast. Thanks so much for being here. Thanks so much for being part of the podcast. Much appreciated. I'll catch up with you soon. Until then, stay safe. We'll talk then. Bye for now. Don't forget to subscribe to our channel and hit the notification bell so you'll know when our next video is out.